Hello everyone, I'm Dr. Astha Dayal and I'm a gynecologist practicing in Gurgaon. I have my clinic in DLF Phase 1 and am also associated with CK Birla Hospital for Women Sector 51. So today I want to discuss about vaginal discharge. So actually I get a lot of young women who come with vaginal discharge or UTI. But सबसे पहले everyone should know that there is some discharge which is a normal discharge. So in a normal menstrual cycle, the first week after your periods, there is hardly any discharge. And in the middle of the cycle, which is between the 10th to the 20th day, there is a lot of watery, colorless discharge which can happen. And in the last week before your period, there is a thick whitish discharge. So this is a normal cycle of the vaginal discharge, and if it is not troubling you, if it is not causing any irritation or smell, then you don't really need to treat it. However, if there is a foul smell, or if there is any burning or pain or itching, or if it is causing other symptoms like painful urination, painful intercourse, then you must visit your doctor and get it checked. So there are different kinds of discharge. So the most common one that we come across is a candidal discharge, which is a fungal infection. Now a lot of reasons can cause this discharge, especially like moisture, or if you have a family history of diabetes, or if you eat a lot of sweets, or if you recently had a course of antibiotics. So this fungal infection can cause a curdy white discharge which causes itching. This can even happen to girls who are not sexually active. And this needs some examination by a doctor, and it needs an antifungal treatment. So we need to give you some oral antifungals and some local pessary as well. Similarly, there are some kinds of discharges which are bacterial infections, like a greenish discharge or a yellowish discharge or a foul smelling discharge. These discharges usually happen if someone is sexually active, and maybe if you're not using protection, then you have a higher chance of having such an infection. This is a little risky because this infection can travel through the cervix. It can go into the uterus, it can go into the ovaries, tubes, and it can cause a PID or a pelvic inflammatory disease. So it is important that if you have any abnormal discharge, you must visit your doctor and you need to treat it. And we generally over-treat such a discharge because we give you a long course of antibiotics so that this infection does not spread to the abdomen. Especially when you're young, in your 20s, you're more likely to get such an infection, and it is important to treat it totally so that it does not spread to the pelvis. Also, I get a lot of girls who complain of UTI. Now, UTI and a vaginal infection are two different things. UTI means a urine infection. It can happen if you use washrooms which are dirty. It can even happen after intercourse, and that really needs a urine examination. So we need to do a urine routine and a culture to check whether there is actual infection in the urine. And उसमें the symptoms जो आपको होंगे, you will feel like going to the washroom again and again. You will feel a little pain towards the end of passing urine. You feel a little feverish. You feel a little chills and shivering. You feel a little nausea. And these are symptoms of urine infection. This also needs antibiotics, and you need to have a lot of fluids and a proper treatment according to the culture with the full course of antibiotics you should do. Now the problem with these UTIs and vaginal infections are they are recurrent. ये बार होती है. So it is important that you maintain some perineal hygiene. जैसे washroom जब भी आप use करें, you must make sure that you are not having any contact. You are avoiding a dirty washroom. Also, for the discharge, you have to be careful that you're keeping the area dry. You always clean from front to back. You keep the area, you wear loose cotton underclothes. You also are able to, you avoid synthetic undergarments and tight lowers, which can cause a little sweating. And avoid a lot of sweets or sugary things. Also, a very important thing is you should always use barrier contraception. You should avoid a lot of scented products in that area, a lot of these perfumes and douches and all, they are very, they could be harmful to the delicate mucosa in that area. So if you have, if you take care about all these things, the frequency of these infections is much less. So I think that is all we're going to talk about today. Thank you.